do you know if your child has ADD? It's a popular question. Well, I'm here in Orange County where one doctor can answer just that and is doing miraculous work helping parents deal with their children who suffer from the disorder.
With the new school year upon us and October being ADHD Awareness Month, many parents can't help but focus on the strength of their own children's focusing abilities, which is crucial for young kids to thrive and succeed in school. Coupled with a fast-paced technology and information-driven society, getting kids to focus is becoming harder and harder, and identifying their problems equally as difficult. That's where Dr. Faber at Amen Clinics in Orange County steps in.
We are in the information age, and I think the next 10 to 20 years, we're going to see a lot of changes in terms of our education, okay, and what really gets prioritized. So what does this have to do with concentration, all right? In order to do well in these types of classes, the more you're able to take in information, understand it, and then either manipulate it or reverberate it back, the more likely you're going to be successful. So henceforth, being able to pay attention and memorize are two big components of that whole piece. You know, so if I'm a parent looking at my child saying, hey, where are the opportunities in the next decade? You know, I'd start saying hard work is one thing, okay, which was kind of like what I was told growing up, but it's more now. It's hard work and learning how to focus better. It's hard work and learning how to read more effectively. Hard work and learning how to memorize more information faster.
If you sense your child may have ADD or ADHD, Dr. Faber says step one is doing your research and finding books and information on how to help your child concentrate and focus better. Step two would be to hire a tutor to guide and inspire your child. Third would be to go seek professional help, like a pediatrician or a psychiatrist. And if none of those options seem to work, Dr. Faber encourages patients to come visit him in his office, where he is taking a revolutionary approach.
Most of the patients we see, they've gone the traditional route, all right? They've seen their psychiatrist or their pediatrician. They've been on stimulants or some other medication similar thereof. They're not working, and the parents feel like they're at their wit's end, so they come see us. And then we start to get a better understanding from a neurophysiological standpoint, what's going on with the brain and how to address the problems. There's several things. One, they'd work with our historian and we'd get a complete history, which means we spend about 2 hours with that individual and their family, getting the whole history from their parents to their grandparents to the course of what problems they've had. Second, we would have them do a number of questionnaires, some of which deal with specific neuroanatomic areas of your brain. We can ask questions to get an idea of where problems might be. We'll also ask questions about other hormones in your body, like thyroid hormone or cortisol, okay? Sex hormones, all because they can affect focusing. There's whole mind-body push, and we use that to kind of get some ideas of what might be helpful. And then we'll do our SPECT scan.
A SPECT scan is similar to a CAT scan, but with less radiation. It allows Dr. Faber to look at how the brain is functioning and diagnose what, if anything, is wrong with it. So far, 75 to 85% of patients who visit the Amen Clinic have had success in diagnosing and treating ADD and ADHD as compared to other methods. Dr. Amen started this approach 25 years ago, and it has since morphed into what it is today. After going through the traditional routes, using prescriptions and holistic approaches, Dr. Faber will turn it up a notch and actually look at the physical functioning of the brain.
We'll put you in our what we call SPECT scan machine, which is basically a machine where we'd put you on a flat bed, roll your head between these three boxes that form a big circle. Looks like a little mini MRI machine. The boxes are actually gamma cameras, and what they do is take snapshots, click, 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 as they go around your head. It takes about 15 minutes for those cameras to do their thing. Once they get to the top, boom, you're done for the day. That's your active scan the first day, then we do another scan the next day where we have you relax a little bit more and do the same thing. With those cameras, we run it through our software and can get some three-dimensional pictures of the brain, looking at both the surface as well as underneath, and start to come up with an idea about what's working well and what's not working well.
The most important step, Dr. Faber says, in diagnosing a child's problem is getting to know your child's teacher well, so you can learn how they're functioning and behaving in class. Typically, society identifies ADD students as children who are overly active and have a difficulty focusing, but it can take many forms and has many symptoms.
The other thing I'd be really observant is some kids aren't overly active, you know, they're actually kind of quiet and they're good kids, but their grades are really bad. And it's like, well, what's going on? Is the kid, you know, we usually hear lazy, or they're just not trying hard? Well, that's sometime, but a lot of times these kids, they just aren't focusing well, okay? So in that case, you want to also ask the teacher, what's your perspective? I noticed my child's a good kid, his Conic scores are well, but why is he getting C- and Ds on these tests? Well, he might have a learning disability. Well, okay, let me ask a couple more questions. Now, this is the kind of stuff we do that I'd be asking, because there's different types of focusing problems.
For more information on Dr. Faber, visit amenclinics.com. Bringing you the best of California and Orange County, I'm Conchetta DeLuca with California Life.